Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Posture and Chiropractic Clinic. I'm here with Ian, who hurt his lower back, so we're going to adjust him and then do some functional rehab. So stay tuned. All right, so Ian hurt his back. Lifting heavy stuff, didn't follow the instruction, didn't keep his barrel, I bet you anything, right? Right, Ian?
No, not entirely.
So this is for my adjustment followers who keep telling me, when are you going to do another video for adjustment? So you're going to watch me adjust Ian, and then the next video is going to show you how I do functional rehab and what we call motion palpation to kind of engage the muscles that have gone into spasm. We don't want to do bed rest. That is not a good idea. So you keep that in mind. I'll explain it more in the next video. So here we go. I go through the palpation and I can see Ian, that one is off. And you're fully rotated this way, so we're going to adjust that. So bear in mind, adjustment is just that, adjustment. Keeping the adjustment and alignment in place is the key, and that comes with a lot of soft tissue work on the doctor's side and on the patient side. So don't think adjustment's going to do the magic by itself, because that's not true. Go ahead and breathe in and all the way out. Oh, that one already went. And we're gonna go, that's not good. Mr. Ian, so this right here is not happy.
Nope.
So that's at L5, S1, where the torso ends and the pelvis begins. That typically is the case when someone sits down too much, so the weight of the torso when you're sitting on this joint is doing damage, or someone who's doing heavy lifting, not using the body mechanics properly, and is using the body to do the lifting, which is, I bet you anything, that's Ian's story. And as a result, this area gets injured. Not a good idea. This side up. Bend your knee. Bring your tuchus forward. Nice and relax. One more time. Face the other way. I knew you were tricking me. There was, the first one was just the lumbar. The second one was the pelvis, which is what I wanted to adjust.
Yep.
Step forward. Nice and relaxed there. That was a freebie, nice and relaxed. Beautiful on your back. So not every cracking is an adjustment. It's easy to crack, but adjustment is very specific. And we induce movement in the direction when there is fixation. It's not just moving symmetrically and freely. So now go ahead and bend your knees. I'm having Ian bend his knees because obviously his lower back is hurting. Wow. His lower back is hurting, so the muscles are going to impact what I feel in the neck, and I want to take that out of the equation. Beautiful.
Babies for days.
One more time here. And we're gonna double check. So I'm gonna do something different today. That's different for you too, Desiree. So right in front of the vertebra in the neck, the front portion, so if this is the vertebra and this is the back, I'm going to the front of it, but on this side. very critical part of the anatomy because there are arteries that go to the brain. So we don't want to be putting pressure on it. I really want to see what's going on this side. And right there. Can you turn your head towards me again? And away. You okay there?
Mm-hmm.
So I really am trying to get in front of the vertebra. You okay there?
Mm-hmm.
Is it sore or can you handle it?
I can handle it.
So that's untouched territory. It's Virgin Island. Ian, go ahead and tuck your chin in. Very good. And relax. Look up. And tuck your chin in. Right there. You feel that?
Yeah.
So we're going to do a little more of that off the camera. We're not forgetting that your lower back is bugging you. So the next video is going to be functional rehab of the lower back. I do not like just adjusting a lower back area and calling it. There is a little more work that needs to be done. So watch that next video. Take care.